Pregnancy is something we all hear about. There are so many magazines about it. But neither pregnancy, and in particular, I think, childcare, come with a manual. And I have to say, I was rather smug before I got pregnant, because I figured, well, I'm a GP, I know all about it. I was wrong. I think so many of us get so much advice shoved at us when we're pregnant. Everybody is a midwife, I think it's fair to say, when you're pregnant. And it's amazing how you suddenly become public property. Once you've reached 6 months, it's perfectly acceptable for the postman to reach out and touch your stomach. You have no personal space anymore. But suddenly, the glamour of that has gone. When the child is well and he's gurgling and he's fabulous and in great shape as these two are, then of course everybody wants to know them. But at 3 o'clock in the morning, there isn't anybody else there, I think it's fair to say. And unfortunately, as we see, there is a huge, huge issue. We don't perhaps have mum or grandma on tap next door to give us advice. And of course, the advice actually has changed. I have to say, when I was pregnant, I do remember telling my mother about, the things that I shouldn't. I went home and I said, oh no, I can't have brie and I can't have this. She said, it's amazing. I didn't know any of this. It's astonishing there's ever been a baby born in the last 100 years. As a GP, obviously, I'm hugely keen on non-pharmacological treatments, on so-called home care treatments. But quite scarily, I always assumed, I think, that mother knew best, and we do what our mothers did, and certainly we do what our friends suggest. Quite worryingly, the nice guidance which has come out and looked at all the evidence on the things that we do for our children in terms of home care shows that really quite a lot of it actually doesn't work. And I will touch on that briefly. But certainly from my perspective as a GP, the question I'm going to get most from the parents is what do we do in terms of medicine? We have 2 options for children, ibuprofen and paracetamol can both be used in 3 months. Paracetamol I give routinely. Every parent who comes in the first time they get their first immunisation at 2 months, I always point out that we give them a prescription because they can have 1 2.5 ml dose as a one-off dose after their immunisation. And I always point out they don't have to give it, but I didn't give it routinely to my first child. By gum, did I give it routinely to my second. And there is no female GP in the practice who doesn't recommend routinely giving a single dose of paracetamol after the first immunisation. None of the male partners do, which probably says something about how much time they spent looking after the children after their child had their first post-immunisation. They both work well, but interestingly, the evidence is that ibuprofen works better. That is absolutely clear from the NICE guidance. What's quite interesting is that this is not cardiology. We don't have randomised controlled trials of 20,000 patients. So what we get is the studies that we've got are relatively small, and although interestingly in the NICE guidance, they are quite clear and conclusive. And the NICE guidance says ibuprofen works better, it works faster. The overall recommendation is give one or the other, there is no preference. But ibuprofen works within about 15 minutes and should provide normal temperature within about 2 hours. There's a minimum of 4 hours between each dose, but interestingly, in our guidance, in the Paediatric British National Formulary, the BNF, which is our Bible, they recommend every 6 to 8 hours. When do we give it? Well, I use this because I don't know if anybody remembers that about a year ago there was a study which came out suggesting that parents who gave their children paracetamol more regularly were more likely to have children who had asthma. And the worry was that giving paracetamol might cause asthma. Well, this was complete nonsense. Effectively, that's like saying wearing tights gives you breast cancer. Effectively, if you look at the statistics, breast cancer is much more common in northern countries, in temperate countries like the UK, like Western Europe. And actually, women are more likely to wear tights in Western Europe. If you go to Africa, it's not very common, and women don't wear tights very often. Does that mean that wearing tights gives you breast cancer? Of course it doesn't. What happened was that, of course, parents who have children who are generally poorly, who have asthma, who become acutely unwell, much more unwell, much more quickly, when they get a fever, are more likely to give their children paracetamol, and those children were the ones who ended up having asthma. So actually, it's not a causeless effect, it's an association. But effectively what we looked at was, therefore, should we stop giving children paracetamol routinely, or ibuprofen. In this case, it was particularly paracetamol, because that was what the study showed, if they have a toothache. And I was going off to do this on GMTV very, very early one morning, and I was at an overnight meeting at the time, a medical meeting, and one of my colleagues, we were doing a meeting on GP training, and one of my colleagues said, "I will save you breakfast." I was really upset, because I said, "Oh, I'm going to miss my smoked salmon and scrambled eggs, I don't get it very often." And they said, "I'll tell you what, Sarah, I'll save you breakfast if you can get Catherine Tate's expression, 'Am I bothered?' into your GMTV interview." So the next day I went in, and I hadn't thought very much about it until I got onto the sofa, and they said, "So when should we give paracetamol to our children?" I said, "Well, basically, the evidence is that it doesn't shorten the illness, it doesn't make the illness longer either. It doesn't deal with the underlying problem. In other words, if you've got a virus, you're still going to have a virus when you've got paracetamol. So if your child's got a fever but they're okay with it, you shouldn't be treating yourself. If your child is miserable, then yes, there is very good evidence that you shouldn't be getting paracetamol. So effectively, you look at your baby with a fever and you say, "You're bothered." If your child is bothered, give them paracetamol. But if they've just got a fever and you're the only one who's bothered, don't. I got my smoked salmon and scrambled eggs. So, which one of the two do we choose? As I've said, the nice guidance has shown us that there is evidence in there for both. But a lot of the evidence that we've got comes from countries like Lebanon and Israel, where they use slightly different doses of paracetamol. The studies are also relatively small, and it's difficult to know, to do what's called a double-blind study. Now, I'm not just proving how clever I am there. Basically, the reason for doing that kind of study is because neither the doctor nor the patient or the parent knows which treatment they're giving. And that means that they can't say, "Yeah, my child was better," because their child had what they thought was the best treatment, because they didn't know what it was. It's difficult to do that sort of study. However, the evidence that there is shows certainly that ibuprofen works more quickly than paracetamol. They both work, and I am a huge fan of paracetamol. But it works more quickly, it works within 15 minutes, and it should usually get your temperature back to normal within 2 hours. Perhaps most importantly, it works for longer with a single dose. Paracetamol never works beyond 6 hours. It's been removed from your system by that time. Paracetamol and ibuprofen both reduce temperature, but ibuprofen at licensed doses, at the standard doses we give it to children, does work more quickly. They both work fast, but at 3 o'clock in the morning, the difference between 15 minutes and half an hour, I think it's fair to say when you've got a screaming baby, she says, "Good feeling," because having seen that baby, it does bring it all back, is huge. Febrile convulsions, I'll only touch on very, very briefly, but just to let you know that lots and lots of my parents, if anyone's had a child with a febrile convulsion or heard about one, it is utterly, utterly terrifying. It is completely normal that if you've had a child with one, you will do anything you can to avoid another one. They are so scary. But they're not that common. About 3 out of every 100 children has one. The vast majority of children, 2/3, will only ever have one. If you haven't had one by the age of about 3 years, it's highly unlikely that your child's going to get them. If you're in the unlucky group of 1/3 who does have another one, even then, you will almost certainly grown out of it by 6 years.